big four. And now we're so happy that we now have the last MTP, medium-term plan 4, which takes us to 2027. We'll have the 2 years, and then the Vision 2030 ends. The idea for us is to now start a Vision 2063 or Kenya at 100. And that conversation begins with the healthcare now, where in the next 5 years, we have more conversations to have a real plan of how we can solve much of the disease problem as it was envisioned by our founders on that sessional paper. Disease was said to be one of the biggest risks we have as a country, together with ignorance and poverty. Pandemic reminded us that it is true. We could implement the Vision 2030, we could have all our plans as we want, but should we have a pandemic like the ones that we have, all budgets go to the side, and there is a whole mess, and we could just lose everything. So the biggest threat, in our view at this point, to the Vision 2030 implementation is a pandemic. It's disease. And I think this is a first step for us to have an action where we actually have a plan in terms of preparedness. So, Tim, please, in that last bit. Now, with this technical, there we go. Your Excellency, if you allow me. Now it works.
With this animal called ethnicity, so that there can be inclusion. We need to create a conditions where elections do not become wars. No country can develop in a state of war. And then the other one is corruption. And we say that this can only stop when the opposition and the government come together. This is not to say that you abandon the oversight role to ensure that everything is being done in a transparent way. And we believe that the Kenyan dream will only be achieved if we bring the country together and heal the wounds that have been created over the years.
So, Deputy President, as the person in charge of the day-to-day oversight of Vision 2030, what would be your message to the public servants who are implementing Vision 2030?
We recognize that this is high calling. Every public servant in every public office must recognize that professionalism and integrity are two most important components that will take us to where Vision 2030 wants this country to be. Those who participate in corruption, or those who look the other way when corruption is going on and theft of public funds, are as guilty as those who participate in corruption. Every citizen playing their role and every public servant being accountable, that is how we will get the targets of Vision 2030.
We have an elaborate scorecard, starting with the political pillar, the issue of devolution and making it work within the first 1 year as opposed to the 3 years that have been provided by the Constitution. When you look at the social pillar, when the vision was envisaged, we had only 19 universities. We now have 59 universities. We had only 31 TVET institutes. We now have 2,000 TVET institutes in our country. But when you look at the health sector under the social pillar, in 2002, under 5 mortality rate per 1,000 live births was 115. That has reduced all the way to 49. Child infant mortality rate had a high of 48. We now have 22. In the Nabras, we can talk of road network. When we started, we had only 8,900 kilometers of paved roads. We now have 12,000 kilometers of paved roads. GDP per capita was only 27,000 shillings. Today, it starts at 167,000 shillings.
Mr. President, how has Vision 2030 shaped your leadership agenda?
When we started off on Vision 2030, we started off at a very difficult time in Kenya's history, as is well known. And with the coming of the Grand Coalition government, we agreed we must have a common vision for all our people, even those who are in the opposition. After all, we all want and wish to achieve the same objective.
Virtually everything that we have done, both in my first term and now in my second term, have all been geared towards achieving the goals of Vision 2030. From the standard gauge railway, from the works that we're continuing to do at the port, and the development agenda that we have for the airports, up to what we are now focusing a lot more on now in my second term, which is health, which is food security, which is jobs for our young people, which is housing for our people, that in the Big Four, we have managed to encompass the aspirations of our people.
It appears your social agenda is very heavy on education and health. What has been your highlight moment when you observe the achievements on the social pillar?
We actually managed this year to move almost to 100% transition from Standard 8 to Form 1. And I am very keen that before I leave office, I will be able to see that magic of 100% transition from primary to secondary and ultimately to tertiary education, where we can say that every single Kenyan child now has an equal opportunity because they have been armed with the necessary skills to take on life. We said that we're going to be providing free maternal 40%. Now we have almost 65% of Kenyan women giving birth with professional attendants. When you look at the power side, today we are over 7 million households connected to electricity. As we move forward, we must also tackle the demon of corruption, because by tackling the demon of corruption, we release funds that have previously been diverted to people's pockets into productive use that can ultimately help us achieve our Vision 2030. My vision is that we will be able to learn from the mistakes of the past, not live in them. And that is the same agenda that today has been escalated to what people are calling the handshake. We must overcome this divisive politics if we are to achieve our forefathers' dreams, and if we are to gift future generations a better country than we found it. My message to Kenyans is, let us come together, let us leave divisive politics, let us leave corruption, let us work hard. 2030 could be with us by 2025.
Thank you, Your Excellency. We are very grateful for the moment you have given us.
Thank you, James.
Thank you very much, Your Excellency.
And I wish you success.
Thank you.
And keep focused.
We will remain focused with Vision
honestly, hats off to the entire Afia house there. Congratulations to them. We came to the third phase, which became another very tricky part, which was vaccines. And the vaccines were scarce. It wasn't available. We got our quota. And then there were different countries producing vaccines. China, India, Russia. And some people wanted to try and bring vaccine as a commodity. And President Uhuru, you remember our conversations that tricky time when the first shipment came. We decided to give vaccines to doctors and frontline workers and elderly. So everybody had to follow the queue. I'm sure in your countries you did the same. But people who are behind the queue wanted the vaccine and they had the money. So they started talking to us saying, what if we bought vaccines for the people and we jumped the queue? And we were puzzled because at your State House we were saying, let's protect lives and we can manage this process. So we thought at one point to go for the Tom Shoes model. For every dollar you pay, you get $1 worth of subsidy and more people get vaccines. And with your leadership, we actually decided that it was going to be the most disruptive, and we put anything to buy vaccines aside because we wanted everyone to be equal, everyone to be safe, and there is never going to be double standards. So I want to thank you for that leadership. You were really, and I think at one point we were thinking of getting people to sell vaccines, but I'm glad we didn't do it because people started selling counterfeit vaccines. They took empty vials from our hospitals and they were selling counterfeit vaccines. So we normalized and we went into self-standards. Mr. President, you'll be glad to note that the people who are gathered here today have not stopped strengthening health systems. Your leadership by the CS here, Dr. Deborah, together with her team and together with many of the private sector have agreed that health security in our region will remain paramount. We are not safe until everyone is safe. All the borders that are around us are working together in harmony. Hopefully, like you made the blueprint of Vision 2030, we want to make a blueprint of health security for East Africa that will enable these African nations to remain strong, to remain steadfast under the leadership of Africa CDC, the team that's sitting next to you, and WHO, so that we remain healthy. Private sector, all in all, has been a great player and will continue to play its part. Many of them are present here, you can see, and are continuing to manufacture, train, treat, and provide research in order for us to have a strong security base in the East African region. I want to once again thank you for your leadership, for your presence and your guidance. We'll always look upon you and we'll always remember the 4 stages we went through during COVID. Asante.
Chairman Amit, thank you so much. Now, Your Excellency, that's private sector. We are now going to hear from academia, the university system, more global university system led by the University of Nebraska, the Chancellor, Dale Davis. Very proud of him. He is a new Vice Chancellor at the University of Nebraska, and they'll be working very, very closely with AMREF International University. And at this point, I want to just recognize the Deputy Vice Chancellor, AMREF International University, who has been working very, very closely with the University of Nebraska. Chancellor.
Thank you very much, Emmanuel, and Mr. President, Cabinet Secretary, General Samson Mwatete, nice to see you again, all members of WHO, Africa, CDC, and all other dignitaries with all protocols observed. I am again honored to be asked to stand in front of you to really try to express the stage of history we're in right now. And I don't think it should be lost on anyone that we are at an inflection point in history. And somebody may be asking, what is an inflection point? An inflection point is when the trajectory of history changes. So you're going like this, and you're either going to go this way, or you're going to go that way, up or down. So we are at an inflection point in the history of Kenya, in the history of East Africa, in the history of Africa, and in the history of the world. And you might wonder why I make the point about inflection point. There are so many forces that are contributing to this inflection point. And the countries that are organized, that collaborate well together, and that are united and have the vision. And I want to commend you, Mr. President, for Vision 2030, because I truly believe that it's those countries and those nations that have a vision that are going to have their trajectory upwards and not downwards. So where are we at this inflection point? Well, the world is changing rapidly. Global climate change is allowing more and more vectors to survive. The vectors are able to carry the disease-carrying germs that can cross borders without any permission. We have now more tornadoes, more floods, more earthquakes, more, you name it, all kinds of natural disasters than we've ever had in the history of humanity. And what we do, how we handle the next 10 years, will truly dictate the course of history. And so our job at the University of Nebraska Medical Center, our Global Center for Health Security, is truly be thinking 24/7, every single day, every minute of every day, as to how we can help, do our part in helping to keep the world safe and to present opportunities for the world to be safe from all kinds of disasters, natural disasters, chemical, biological, radionuclear, all kinds of disasters. That's what we do, that's who we are. And we're really, we value and cherish the opportunity to be here today in this conference to exchange ideas and to come together to be able to make sure that we work together in a global mind frame in trying to solve this problem. Mr. President, I heard you on that video say we must avoid divisive politics if we are to achieve the dream of our forefathers. And I want to just hop on that for a minute, because you're all here today at a conference, and some of you are going to leave here thinking that was a nice meeting, and you're going to go back to your normal lives. And you're going to think, some of you might even say that was a waste of time. But there are others of you who are going to say, this meeting is something that I'm going to use to change the trajectory of my community, my state, my nation, my continent, and in fact, the world. And whether you think you're in one of those three categories, whichever one you feel like you belong into, you're absolutely right. Because whatever you think, that is who you are. And I want to really encourage all of you to think through what you're going to do in your part to make a change as a result of attending a conference like this. The power of conferences, the power of connections, the power of hearing ideas and sharing ideas is why we're here today. I want to allude to a conference in 1945. It was a conference that was organized towards the end of World War II, where a group of African and West Indian students in the United Kingdom organized a Pan-African conference. It was a conference just like this. And the whole idea of that conference was to talk about how Africans and West Africans can change the trajectory of the continent here and have self-rule for Africans. And out of that conference emerged some names that you might recognize. Kwame Nkrumah of Ghana was there, Tafawa Balewa of Nigeria, and Jomo Kenyatta of Kenya. One conference. All three of these people, many years later, ended up taking the ideas from that conference and others. I bet there were more than 3 people at that conference. Actually, my dad was one of the people at that conference as well. And the ones who left with the idea that they could change something ended up becoming transformational leaders in the state of Africa. You know those names. They all became founding fathers of their countries. And so I'm trying to make the point that these conferences are not just opportunities for us to sit and enjoy each other's company. We all have to leave in the next couple of days feeling energized and understanding what is at stake. Because what is at stake is really the future of this nation, the future of East Africa, is the future of humanity when you think about it, with all the things that are going on. And so over the last couple of days, we talked about the need to build capacity in the healthcare workforce, to build local manufacturing capacity for vaccines, to build opportunities for health finance, for partnerships that will allow us to share the best practices in global health security, to build strong and resilient communities, surveillance systems, and I wanted to add one more, to build the mental health of our populations. Because one thing that we discovered during COVID was isolation is not good for human beings. And we've got to really think about how we build the wellness and behavioral health of our nation. So I really want to just encourage all of you. I really believe that the future is bright, and you are all change agents. I don't want anybody to leave here thinking that this was just a meeting, a nice meeting to say hello to people. My charge to all of you, to all of us, is you are change agents. And every one of you has the ability to impact your community. And you can't do it alone, I can't do it alone, but together. When we come together and exchange ideas and work together, I truly believe that East Africa is going to lead the continent and the world in terms of health security. Thank you very much.
Thank you so much, University of Nebraska, and all your team for leading us in this space. And now, Your Excellency, we want to move now to the member states. And the member states, of course, are led by our partner, the Africa CDC Eastern Region, and very, very glad to have the Deputy Director here representing Africa CDC. Tumpigie makofi tafadhali.
Your Excellency, the fourth President of Republic of Kenya, Uhuru Kenyatta, Cabinet Secretary, Minister of Health of Kenya, Ministers, Head of Delegation from AU member states in the East African region, WHO and other partners here present, and of course our partners all the way from Nebraska. I bring you greetings from His Excellency Dr. Jan Kaseya, the DG of Africa CDC, who actually would have loved to be part of this discussion. But as we are all aware, we are in the preparatory phase of the AU summit, which is coming up in less than 2 weeks from now. Your Excellency, the continent of Africa records over 150 disease outbreaks annually. Last year alone, we recorded over 240 disease outbreaks. These outbreaks begins and end in the community. Therefore, we need a resilient epidemic and pandemic-ready primary health care in order for us to be able to guarantee the health security sovereignty of our member states. The primary health care that align with the AU Agenda 2063, the Africa we want. A primary healthcare delivery system that align with Agenda 2030, a sustainable development goal. Your Excellency, what are we doing as Africa CDC to guarantee the health security sovereignty of our member states and the universal health care? Africa CDC has set up a Center for Primary Health Care. And the key priority areas of focus for our primary health care include non-communicable diseases, mental health, and injury. Number 2, community health system. Number 3, HIV, TB, and malaria. And last but not the least is sexual, reproductive, maternal, newborn, and child health. Now, the big question is, what is Africa CDC doing to support our member states? Number 1, we have the Center for Health Economics and Financing that is working with our member states to see how do we optimize the locally available resources in such a way that we're able to ensure financial protection of the 70% of our population that access their health care at the primary health care level. This discussion around health financing, given what is happening globally now, I think is one area where we need to put a lot of attention. And come February 14, our head of state and government, under the leadership of President Paul Kagame of Rwanda, will be convening a meeting at the sideline of the AU Summit in Addis Ababa, Ethiopia, to have a robust discussion around health financing. What sort of innovation do we need to bring into that space? And how do we better mobilize domestic resources to support our health agenda? Your Excellency, number 2, there is no health without workforce. In fact, there is no primary healthcare delivery system without workforce. Today, Your Excellency, you and your peers, back in 2017, you gave us a mandate to train and deploy 2 million community health workers to support our universal healthcare agenda, and also to support reaping the dividends of our demographic, our youth, who by far are the major, proportion of our population. And in that regard, Africa CDC has taken the bull by the horn. We've set up what we call the Continental Coordination Mechanism, to ensure that we are able to train and deploy these community health workers. And in fact, between now and 2027, Africa CDC will be training and deploying 500,000 community health workers. And we're also working with the global players, WHO, UNICEF, within the initiative called the Community Health Delivery Partnership. Number 3, Your Excellency, Africa CDC is also working with our member state to ensure that our primary health care have, 1, digital health as a core component of their primary healthcare delivery system, connectivity, and solarization, because we know that for any primary healthcare delivery system to be able to function optimally, we need digitization, we need connectivity, and we need solarization. And Africa CDC has finalized arrangement to support 100,000 primary healthcare systems across the continent of Africa. Number 4, Your Excellency, there is no health security without a local manufacturing agenda. We need to begin to mobilize, resources to ensure that we're able to produce our own vaccines, we're able to produce our own diagnostics, we're able to produce our own therapeutics. In fact, my DG, Dr. Jan Kaseya, has described this as the second independence of the continent of Africa. Today, we only produce 1% of our vaccine needs. You cannot guarantee health security by importing 99% of what you need. So this is a very big agenda. And in February 2024, at the last AU Head of State and Summit, we got a declaration and decision from our Head of State and Government for us to lead the agenda on local manufacturing for these health security commodities. And tied to that, we have also embarked on an initiative called the African Pool Procurement Mechanism. Your Excellency, we know today that the primary healthcare agenda is not complete without a robust supply chain management system, without equitable, affordable access to those essential health products, because this underlines, a very strong primary health care. Number 5, Your Excellencies, partnerships is key to this agenda. We know there are so many players in that space. What is lacking is coordination, collaboration, communication, and cooperation. So Africa CDC is working with all the major players to ensure that we are able to coordinate what is happening in that space, so that we are able to streamline the resources that is coming in that space as appropriate. And in this particular space as well, we are working with our private sector, talking of the telecommunication giant around digitization of our primary healthcare system. We are also working with other private sectors to make sure that we're able to leverage resources at the disposal of these private, the private entities. Your Excellency, to conclude, I would like to say here that to achieve universal health care, to achieve air security sovereignty of our member state, we need a strong, resilient, robust primary health care delivery system. A PHC that is both pandemic and epidemic ready. Thank you. Your Excellencies, allow me to use this opportunity to call on WHO Dr. Abraman Diallo to give his remark.
Thank you very much, my brother Dr. Raji. Your Excellency, President Uhuru Kenyatta, Madam Cabinet Secretary Health, Dr. Barasa, honorable ministers and representative of member states present, ladies and gentlemen, all protocol observed. Mr. President, it is always a pleasure to see you on a health-related matter. Please allow me to just recall a few things about your leadership in health. For those of us who were involved in putting Africa CDC together, when the original board members discussed the possibility of member states actually contributing to the functioning of Africa CDC with your leadership, and I was a board member, Kenya was the first country to step up and actually commit to support. Whether that happened or not, it's a different story. And two, when I was the Chief Executive Officer of Rollback Malaria in Geneva under the UN, as you remember, Alma appointed you as the chair of the Africa Leaders Malaria Alliance, and as such, you took the alliance, the fight against malaria on the continent to the next level. I still remember our meetings at State House every time you invited me, how you quickly developed your 4 legacy items in the fight against malaria on the continent, and you appointed a focal point on the spot to make sure that those become reality. Finally, your instrumental role in supporting the fight against disease outbreaks in Africa, especially emergencies. You were instrumental in establishing the WHO Regional Emergency Hub in Kenya. In fact, with my Director General, you did the groundbreaking. We did it together. And although the construction has not happened, but the hub is operational, the team is operating from here, supporting various African countries in responding to emergencies. There is a stockpile of equipment and supplies for health security being dispatched from Kenya. And in partnership with Africa CDC, many emergency responders have been trained as part of the ad hoc search initiative, and those are also being deployed from here to respond to various emergencies. And again, thanks to you, to your leadership, Mr. President. So for us, we see this as an opportunity to reflect on various lessons learned. We heard from my brother Dr. Raji that Africa experiences more than 100 disease outbreaks a year. So a lot of lessons have been learned. I mean, we've done some things right. We've made some mistakes. It is time to take a step back, reflect on those, and focus on the way forward and how do we improve this. For us, this is just an opportunity to rally all the partners and all the players around the table to have everyone put their shoulders to the wheel to make sure that we improve our capabilities in responding to emergencies on the continent. Again, Dr. Raji has talked about the thematic areas that we would like to see discussed in the summit. I'm not going to come back on it. So just a call to all member states. I know this is about East Africa, but I talked with my brother Emmanuel about expanding this beyond East Africa. So it is a call to rally everyone around this huge task, which is fighting emergencies in Africa. Thank you very much.
Thank you, Dr. Diallo. So at this junction, I would like to invite the Cabinet Secretary Ministry of Health of Kenya, to give a remark on behalf of the 40 member states who are here present. And Your Excellency, let me also use this opportunity to crave your distinguished indulgence, to allow us to, the ministers who are here, to have a very short meeting with you after this particular session. Thank you, Your Excellency.
Thank you. Your Excellency, the 4th President of the Republic of Kenya, Ministers of Health in East Africa and beyond, WHO representative, country representative, Africa CDC Director, Deputy Director General, all protocols observed. Good morning. So, Your Excellency, the importance of global health security. Global health security is really critical for safeguarding the well-being of populations and economy, especially in the face of emerging and re-emerging health threats. We have learned a lot of lessons from the COVID-19 pandemic, which has emphasized the need for preparedness, innovations, and regional collaborations. Again, in Africa, we've had multiple emerging, re-emerging infectious diseases, antimicrobial resistance, as well as climate change, which all have had a united approach across borders to ensure health resilience. What are Kenya's efforts in strengthening health security? We have invested in modern healthcare infrastructure to respond to emergencies. Again, we've had commitment to regional collaborations where we've had knowledge, experience sharing sessions, best practices, resources within the neighboring countries to support this. Again, we have focused on capacity building sessions with support from, again, partners like Africa, CDC, WHO, among others, in matters global health security. And we also thank the University of Nebraska, which will be supporting us through AMREF, KEMRI, and again NPHI to improve capacity building session. Equally, we've had public-private partnerships which are fostering innovation and mobilizing resources. We've seen in the Expo Safaricom with their digital health, and so we are working again with the partners, and again empowering communities through initiatives like the community health promoters. Again, critical is the UHC. Your Excellency, as you are aware, even during your government, there were a lot of discussions and piloting in matters UHC, which is really part of the SDG 3 goal. And so, as Kenya being the big brother of Africa, we are looking to be pioneers in UHC and again be best practice in Africa and beyond in matters affordable, accessible, quality care through the Taifa Care. So the summit's role is anchored on the theme of securing health and prosperity, one community at a time. And this theme has been broken down into 3 sub-themes to guide conversations each day. Day 1, we talked about the whole of community approach, which emphasized the collaboration efforts required for health security involving all sectors of the community. And in day 2 today, we are talking about building resilient health systems. Centers, the day will be around improving health systems, a vital area for achieving effective health security. And again, we hope to talk about UHC during this time. And in day 3, we'll talk about building sustainable preparedness, that is emphasized in importance of long-term preparedness strategies for future health security and challenges. So the key highlights following yesterday's discussions. Yesterday we set the tone for the summit, outlining objectives and stressing the significance of advancing regional health security. There was a leadership commitment to advancing health security in the region and discussions on regional health security priorities, and we reflected on lessons learned during COVID-19, what went well, what went less well, among other outbreaks, and emphasized on building resilient communities during this. There were also discussions on the role of private sector, discussions on the role of the National Public Health Institute, which is critical for better pandemic preparedness and sustainability. Again, discussions on biosecurity and bioterrorism in East Africa. There were conversations on big data and AI in healthcare, and discussions on the role, transformative role of data and AI, which is now currently one of the big agendas where we are rolling out digital health. We hope to have 100% digitalization of our health system in Kenya. Equally, we had sessions on academia and research, which highlighted the importance of academic institutions in fostering innovations and building capacity in health security. And so this summit serves as a call of action on health security, urging partners to move beyond discussions and turn towards commitments into tangible actions for a healthier, more resilient region. And so my pleasure to welcome you, Your Excellency, to address the people. Thank you.
Thank you very much. Please be seated. Thank you very much. Waziri Deborah Baraza, Cabinet Secretary, Ministry of Health, Kenya. Heads of delegation here. The CDC Deputy Director, the WHO Country Director, Ahmed, friend Emmanuel, and all attendees. Good morning. Let me begin by saying that I'm happy to be together with you today. I do not intend to take up much of your time. It's not my business to take up your time. You are the guys who are planning for the future. We have done our part. Ninimalize niende nikafanya yangu ya nyumbani na nyinyi muendelee. But let me begin by appreciating through you, Dr. Davis, the University of Nebraska and your entire team for inviting us to come and join you and to give some of our perspectives that could hopefully give our continent the ability to take charge of its health sector in collaboration with other international organizations, but more importantly with our own organizations such as our Africa CDC, as is represented here. And I'd like us to go back a little bit and recall the year 2020, which was the beginning of a very difficult time for us as a country, for the world, but also for me individually. When our world basically came to a standstill, taking everybody by complete surprise and forcing nations to begin to ask themselves when this pandemic would actually arrive at our respective doorsteps. As president at the time, and in consultation with my cabinet, we found it prudent, well before the disease was found within our borders, to set up the National Emergency Response Committee on Coronavirus. The role of this committee, chaired by the then Cabinet Secretary Mutahi Kagwe, was to help steer the country and to navigate the uncertain season with an emphasis on coordinating capacity building of medical personnel and other professionals to enable our country to respond quickly and effectively to any suspected cases or outbreak of the virus that would occur or could occur at that time anywhere in the Republic. Other roles of this committee included enhancing of surveillance at all our points of entry, preparation of national and county private isolation and treatment facilities, because we began by having immediate sessions, and I convened an immediate session with the Council of Governors to work on this. We began to coordinate the supply of testing kits that would be critical, looking out for medical products, supplies, pharmaceuticals, and masks, and other protective gear that were available within the Republic, as well as identifying isolation and treatment facilities, as you heard a little bit from Amit, who spoke before me. And all this we did knowing that sooner or later we would be confronted by the coronavirus. And all these measures we put in place in the month of February 2020, and indeed, as fate would have it, on the 13th of March the same year, we got our first ever COVID-19 case, a 27-year-old woman who had just traveled to Kenya from London. This, ladies and gentlemen, marked the beginning of a long year, not only in the health sector, but throughout all sectors of Kenya's economy. It affected us economically, socially, and as of all of you know, our Kenyan culture is founded on community, on gatherings, and these, unfortunately, became the first casualties. For we had to ban all public gatherings. We did initially give reprieve to churches and businesses at large because we were worried about what would happen to all those who were employed and working in these various sectors. But again, unfortunately, within no time, it became impossible to keep that going. And we had to pull the plug totally on all in-house kind of gatherings and proceeded to institute a total lockdown of the country. This was a very bitter pill for Kenyans to swallow, but it was a necessary measure to help curb the virus and protect the people of Kenya. Ladies and gentlemen, let me just highlight just some of the key measures that we took. Some of them, again, have been mentioned by some of the speakers before me, so I will not bother elaborating. But the first of these, as has been stated, was communication. Poor communication results in confusion. And as we all know, communication during such a season as COVID was very important. Keeping the people informed and giving hope as they wondered what would happen next. So as a government, we agreed that the National Emergency Response Committee would be solely responsible for all forms of communication around the pandemic. And to this end, I authorize that only the Cabinet Secretary for Health would speak on behalf of the government on all matters related to COVID to avoid any kind of misunderstanding or misinformation, and he became the single source of truth, so to say, about measures on the disease. The only other communication that was permitted was from yours truly, who would speak from time to time when landmark decisions needed to be made, especially those related to the lockdown, economic stimulus, and calls for calm, and so on. And as many of you will recall, I did endeavor in a good number of times to ensure that during those occasions, I was also flanked by leaders of the opposition to further reassure Kenyans that this was truly a national crisis. We did realize that this did contain the pandemic and the panic, especially in these times of social media, but it also ensured that as a government, we controlled the narrative. With regard to health, occasioned by the big number of COVID patients, it became imperative for us to upgrade a good number of our health facilities to help with patient control. The public sector, private sector, as well as our military, all joined forces in handling the ballooning number of patients. As a government, we went ahead and put in resources, redid and rejigged our budget in order to be able to build additional hospitals and to increase the capacity of existing medical facilities. We also, at the time, knew that we were not financially prepared and we needed to source funding for us to be able to deal or take challenges of the lockdown. Was that it resulted also in our revenue collections dwindling at a time when the country needed these resources the most. And we had to grapple consistently with how we were going to finance our operations, but at the same time keep the nation moving. So as a government, we created a COVID-19 fund, a kitty that would fund emergency response towards containing the spread, its effects and impacts. But we also said in sharing the burden occasioned by this pandemic, we said we had to lead from the front, and myself as president and the deputy president took an immediate salary cut of 80% of our salaries. Cabinet secretaries, I don't know whether they were happy or not, but I ordered that they take 30% cuts. And principal secretaries and other top officials, we gave them the chance to volunteer to take 20% pay cuts in order to show that commitment and leadership starts at the top. We also called on well-wishers, and in this regard, I really want to thank our Kenyan private sector, because despite the challenges that they themselves were facing, they came out strongly in support to ensure that at least the most vulnerable were able to put food on their tables. This especially because a huge part of our Kenyan workforce was casual. And many of our urban citizens rely on a daily income to sustain themselves. And we recognize this. Because those casuals, with many of them now at home as a result of the lockdown, and who depended on that daily income to feed themselves, now had basically no source of income. And the big question became, how could we effectively look after this part of our population? And that, ladies and gentlemen, is how my government came up with the Kazi Mtaani program. And the Kazi Mtaani program was intended to put money in people's pockets in order for them to be able to sustain themselves during that difficult time. In rural areas, people had their small plots and their ngombes and their mbuzis. But in urban areas, this was very difficult. So therefore, unlike what some people tried to indicate that this was a political agenda, it was socially, totally aimed at ensuring that these Kenyans who, through no fault of their own, were unable to go to their places of work, at least would have an opportunity to earn a living and be able to continue to support their families during that most difficult time. The other big question that we had was how some of our industries could continue to produce. Because as you remember, as I said earlier, this was not just a health crisis. It was also a social and economic one. And how we would keep our economy afloat despite this setback. Medical products and supplies were running low with the entire globe fighting the pandemic, and it became difficult to readily access many products. And once again, I want to thank our private sector, because upon consultation, we commissioned our manufacturing industry to begin using their existing lines to make things like ICU beds and units from scratch, to increase oxygen production, to make masks as opposed to t-shirts and other things that they were making for other markets. They started making masks, they started making PPEs, they started making sanitizers, they started making all manner of medical equipment that was to prove critical during this period. And we also realized that the need was growing as the virus was spreading far and wide and in scales that we had not witnessed, that without, once again, the help of private sector, we would not have been able to keep the deaths to the levels that they were. We were further, as a result of that initiative, able to increase our ICU beds from, at the time, 537 to 1,353 ICU beds, a good number of those made by our local manufacturers, giving those infected by the virus a fighting chance. We were also able to build many physical isolation units, and we could transform, and as again Amit has said, some hotels and others graciously gave us access and schools to their facilities which could be transformed into isolation centers that were affordable to the average Kenyan. Secondly, I've mentioned that we also introduced a stimulus package, and I've mentioned about Kazi Mtaani and where it came to. But we also realized we had to increase from those, especially civil servants and others, and the average Kenyan worker. We realized that we also needed to increase their disposable income during this difficult time. And we came up with measures such as, for all those earning 24,000 shillings and less, we released and relieved them from tax deductions, VAT, pay as you earn, and such other things to Kaondoa, so that people would have more disposable income. We reduced our VAT by 2%, just to mention but a few of the actions that we took to help ease the pressure on Kenyans. And by the way, I must also recall that the Kazi Mtaani program went a long way, not only to help provide an income for many thousands of Kenyans who were out of work, but it also went a long way to help us prevent a lot of diseases that were related to dirt and filth, illnesses like diarrhea, cholera, malaria. By extension, we were fighting coronavirus, putting money into people's pockets, but at the same time, we realized that that action was also helping us deal with other common diseases that had afflicted many, especially in our urban centers. And most importantly, it kept our youth away from indulging in crime-related viruses. So ladies and gentlemen, these are just a few of the measures that we took to help us grapple with this menace of COVID-19. But I also want to talk a little bit about vaccines. Because when news came that vaccines had been found and were available, that good news that was spread on CNN and BBC and everywhere else, making us all totally very excited, we soon realized that that news was not for us on the African continent, it was for others, since these vaccines were not available to us. But we were told now how they are available, but the good news, unfortunately, was not for Africa. We couldn't access. And so, at a continental level, we sat as an African Union, convened meetings, and for the very first time discussed how would we as Africans avail ourselves of these much needed vaccines. To cut a long story short, after many numerous discussions, working together under the coordination of Africa CDC, we were able to find adequate vaccines for our people. But that would not have been possible without the coordination and the collaboration of Africa as a whole. This was a great eye-opener for many of us, and at that stage, I must appreciate the African Union under the leadership of Musa Faki and the then Director General of Africa CDC for recognizing that it was important that the Union come up with a framework that would spearhead the development and access of COVID-19 vaccines to Africa. Again, at that time, I was the chair of the Organization of African, Caribbean, and Pacific States, as again has been said by my brother, Dr. Davis. And for the very first time, we managed to pull together with the nation states of the Caribbean and the Pacific, who were also facing similar challenges. By social media, AI-generated propaganda. This is going to be your biggest challenge going forward. How do you deal and ensure that citizens across the continent are armed with the correct and factual information? I also believe that a lot still has to be done to educate and equip our masses on the importance of vaccines, not just this COVID vaccine, but in preparation for the future. And our leadership, both at continental, national, and community levels, must take a role in this. Today, you are all here to deliberate on global health security systems, something that is critical and crucial because it comes at a time that we need to be prepared, not if a pandemic shall occur again, but when that pandemic occurs, that it should not catch us flat-footed as did COVID-19. This, I believe, ladies and gentlemen, is an opportunity for you to discuss ways and means of how we can be better prepared to face any new pandemic that may arise in the future. And again, I emphasize that it is a matter of if. It's a matter of when, not if. And also as Africans, not to wait for others to come to our rescue. As I told you, our excitement when we watched CNN, BBC, and everybody else celebrate these new vaccines that were being rolled out. But as we were celebrating watching the TV, none of this was coming to us. So my friends, any future pandemic that comes, don't think anybody out there is going to come and look up. They'll look after themselves first. Then if there's any surplus, bas mutapatiwa ile mebaki, mujisaidie ile kidogo kidogo tu, mtupiwe tu, mkule huko kando. Hata mtapatiwa bure, kwa sababu sasa at that time hakuna shida, wamejitengeneza, nyinyi sasa shauri yenu. So you have to actually see how we ourselves are at the center of the discussion of any future pandemic that may occur, and how we as Africans are going to be prepared with our own resources, with our own vaccines, with our own research, with our own academia, with our own private sectors, to prepare ourselves to face any future challenges. And let me conclude by saying that whether we like it or not, funding for this has to come from ourselves. It has to come from ourselves, because we have to begin to reprioritize what is important for us as Africans on the continent, and where should our resources go. And towards that end, to remember the amount of resource we waste killing each other. When you see the devastation caused across this continent by the many unnecessary wars, Sudan, DRC, all across the Sahel, all across the continent, we have actually lost more people to bullets fired by Africans on Africans than we actually lost to the coronavirus. And we have actually spent more buying those bullets to kill ourselves than we have actually spent on protecting our health and our societies. So an end to war and a collaboration towards putting an end to these conflicts and being able to repurpose our resources to where they shall have the greatest impact on our population shall remain the biggest and most critical agenda for the African continent. Let us be ready and let us be prepared. Let us be self-reliant by ensuring that we deal with the challenges that we have in order for us to be able to free resources for where they are most needed. I saw some people the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. I mean, you don't pay taxes in America. He is appealing to his people. Shauri one. This is a wake-up call for you to say, okay, what are we going to do to help ourselves? Instead of crying. Tujiulize, what are we going to do? Haya ametoa hiyo pesa, sasa tutafanya namna gani jameni? What are we going to do? To support ourselves. Because nobody is going to continue holding out a hand there to give you. It is time for us to use our resources for the right things. We are the ones who are using them for the wrong things. The bullets and the guns we buy, we are not given for free. We buy them. And we're not buying them to go and fight wars off our shores. We are fighting our own people, hapa too. Brother killing sister, sister killing brother, over stupid things. Let us work together to bring an end to all of that and to focus ourselves on those issues that really matter for our people. I thank you very much.
Thank you very much, Your Excellency. A round of applause. I'll request you to please be on stage. Allow me, sir, to welcome you back on stage for a group photo, really quick. Allow me to invite Dr. Nzai. Really happy for your presentation on the bit about communication and the bit about the conversation from the military. So allow me to also have General Motete on standby, Madam Kanzenden as well on standby. Let me have the representation from the Africa CDC, the country director as well, WHO. Let me have on standby the University of Nebraska, just to be on standby here. The first photo, ladies and gentlemen, will be that of the Cabinet Secretary, Dr. Nzai, the Africa CDC, and the World Health Organization. Really quick. Africa CDC and World Health Organization, University of Nebraska, on standby, please. All right, there we have it. Let's give them a round of applause, ladies and gentlemen. Thank you so much. Thank you very much. Okay, I will excuse the WHO team and the Africa CDC team and still have on stage Dr. Nzai and the Cabinet Secretary. Let me have the University of Nebraska. University of Nebraska. University of Nebraska team, please come on stage. University of Nebraska, thank you very much. Sponsors and partners, one representative each. Sponsors and partners, particularly. One representative in the University of Nebraska. Sponsors and partners, hold on. Thank you, University of Nebraska. Thank you, University of Nebraska. Let me have sponsors and partners from Safaricom, ILRI, EXA, AMREF, Biovax, East Africa Medical Vitals, and Revital. Join the team, AMREF. Ministers, I'll have you on standby. Ministers, I'll have you on standby as well. Thank you. The ministers, please, from the 14 member states, please. Ministers, please come. Ministers from the African Union region, the 14 member states, please welcome, including Botswana as well. Thank you. Dr. Gomelenga. Gome, please come on stage. Ladies and gentlemen, and in view of the mention of the former staff, I don't know if Kanzeden is still here. Allow me to welcome Madam Kanzeden. I think, thank you very much to our honorable ministers. I'm going to excuse you on stage, but ask you to please stay on because I want to invite Kanzeden and I want to invite General Motete and Gomelenga because in your leadership, you mentioned about communication and the military who are your greatest partners as well. So it's only fair that I recognize the people behind the scenes. Dr. Gomelenga, you could please join them on stage. These are... And also to mention yours truly as well, served at the PDU, so I'm happy that we can be able to take this photo. Thank you. All right. Kanze, thank you. Anyone else missing, Kanze? Go, Doctor, go. Yes, that's it. Thank you very much, ladies and gentlemen. We have the next session. We have the next breakout session. Thank you, Your Excellency. We're really grateful for your time. We'll proceed on as the Excellency leaves for key deliberations outside this hall. Please let's have the Dr. Judith Kose will be leading the next conversation on stage, where we're having the role of community health workers. This is the breakout session 1, and after which we'll have the regional manufacturing solutions at Shimba. Let me announce again that we are now at the breakout session at the plenary. Can I have on stage Dr. Yeah. All right. At this very hall, we're going to be having the role of community health workers in strengthening health systems. We also have regional manufacturing solutions for health security. Regional manufacturing solutions for health security. That will be Dr. Sam Nyingi, if you're here. Dr. Sam Nyingi. All right. Dr. Rogers Ayebari. The session with Dr. Sam Nyingi will be at Shimba Hills room, and also have the